When an elderly person goes into hospital, the aim is, of course, to get them better. Ironically, they can often leave in a worse condition because they spend too much time in bed getting weaker.
The lack of movement is called deconditioning. It happens when staff in pressurised hospitals are too stretched to attend to older people, to help them get up and get out and about. Alistair Fee explains.
Nice big steps, Mum, nice and straight. When Mum returned home and into our care, she was immobile. She couldn't wait there, couldn't stand.
86-year-old Iris has recently returned to her daughter's home from Poole Hospital. She'd had a bad fall and was there for 4 weeks.
If they had got her up on a daily basis and tried to mobilise her, if they had taken the time to engage with her, and I do appreciate the enormous pressure that the NHS are under and that they are under-resourced. I think we wouldn't be where we are now with Mum. We would have been a few steps further on in her recovery.
It's well known that the elderly get weaker and lose motivation during long stays in hospital. At Bournemouth and Poole, around 20% of beds have patients who are medically ready to go home but are waiting for support in the community.
And we do try, so we try and get people out of bed as quickly as possible, particularly after things like a hip fracture. There's very early mobilisation of people, but the staff are really busy. The staff are pressured by other things, and so it's not always possible.
Joan is another who is weaker for her stay at Poole. She's 96 and before she went into hospital was living independently.
She was a frail elderly lady, but she became very frail.
Joan is now at a rehab ward at Fordingbridge Hospital and the family are pleased with her care and progress, but getting her home is still a challenge.
We can't get the carers. They're not out there. The 2 carers that are needed 3 times a day, that is. So we are struggling with that, and we don't want to put her in a home. We feel that, like I say, she's 96 and she deserves to come home and be in her home environment.
Nice and gently.
Support outside of hospital is preventing hundreds of elderly people leaving, which means many are getting weaker. Iris was told the waiting list for occupational therapy at home could take up to 3 months. A private physiotherapist is now coming in to see her 5 days a week, and she's making a good recovery. Alistair Fee, BBC News.
We're joined now by Professor Adam Gordon, who's president of the British Geriatric Society. Good morning.
Good morning.
To you. Now, what I do want to make absolutely clear is this is a reflection. We will talk about the subject of, deconditioning. This is not a criticism of the pressure or the nurses that are working and the hospital staff that are working. They are under a certain amount of pressure and a very time poor. And that is kind of one of the contributing factors to this issue of deconditioning, because as the daughter of one of the patients there said, if there was just the ability to get her mum up once a day, get her mobile, so they'd just be a few steps ahead. And it's the knock-on effect that then has in extra care at home or further visits to hospital.
Well, absolutely. If you look at where we see pressures on the system at the moment, we're seeing unprecedented delays in ambulance response times. We're seeing unprecedented delays in accident and emergency departments. If you've got an older relative who is lying on the floor for a period of time and then goes into an emergency department, it takes them maybe 4 or 5 hours to be assessed and then another 4 or 5 hours to get to a ward. Even before they've got to a ward environment, they may have spent 15, 20, 24 hours immobile, and as a consequence of that, they will have lost muscle mass and have experienced some decondition.
Which is obviously going to happen because it's biology, isn't it? The older you get, the less likely you are to kind of spring back or kind of be able to heal.
Well, this is absolutely an example of the old mantra, if you don't use it, you lose it. We all of us need about 30 minutes of exercise, enough to raise our heart rate, enough to make us feel warm in our core every single day of the week. And if we're not able to do that, for example, older people during the pandemic often didn't do as much exercise as they had done prior to COVID, or if you go into hospital, then you will very rapidly start to lose muscle mass. And in older people where they maybe have less muscle mass to start with, there's a significant significant likelihood they may lose some function, for example, when they're walking, or their balance as a consequence of that.
Professor, you spend 2 days a week, you're a geriatrician, you're a consultant.
I am.
2 days a week you go and see people in hospital in a setting. So what do you witness? I mean, give us an example of someone you see who's in one sort of condition who can be helped to get to a better place. Can you give me a sense?
Yes, yeah, I can. So there was a very good campaign nationally a few years ago. It was called End Pyjama Paralysis, and it very nicely outlined everything that we can be doing in a hospital setting to prevent exactly the type of deconditioning that we've just been hearing about. And these are often very simple things. So, for example, getting people out of their pyjamas and into their daytime clothes makes it easier for them to move around in a dignified way. Removing drips and tubes, cannulas and catheters as soon as possible in the admission so that people can get up and moving, ensuring that if they need glasses in order to get about safely, that they can access those, and if they use walking sticks or walking aids, that they are within reach so that they can actually get to and from the toilet.
Well, and those are very common sense. In a way, that's common sense, isn't it?
Yeah.
But coming back to the point, I think, that sort of sits over this, and I know you're not here as a politician, but all of those things you're talking about there are time-consuming. It's going to take... You will know this, you can explain to me. Someone who hasn't got out of bed for a long time, it could take a long time to get them out of bed, to get them dressed, which is a good thing. But then it becomes an issue of, is there time in a busy ward where they're under enormous pressure?
I think it's absolutely true that these are time-consuming things. They are priorities. In most wards where we routinely care for older people, we do prioritise these things, but we don't have the same ability in a ward-based setting to get someone up and around and moving as perhaps they might do in a community rehabilitation setting or when people return to their own home. And that's partially a consequence of just the staff being thinly stretched. It's partially a consequence of the fact that hospital environments are much more difficult to move around safely within, and often older people themselves don't feel particularly comfortable moving around without supervision. So you spoke about the political situation, and we know at the moment we're facing large crises in the social care system. That leads to what we call delayed transfers of care, people who are medically stable for discharge but can't leave hospital because there's no care packages for them in the community or no places for care homes for them in the community. And we saw that awful statistic from The Guardian a couple of weeks ago, where up to a third of hospital beds had people in them who were medically stable for discharge and are waiting for rehabilitation. So I think the staff are working as hard as ever and often doing a very good job, but people are spending longer in hospital than they should do.
We're talking about physical deconditioning, that's what we've touched upon. There's also cognitive deconditioning as well, where if someone just isn't stimulated in a care setting, that itself can cause deconditioning degeneration much more quickly the older you get.
Yep, so the evidence around physical conditioning is very well established. We understand that phenomenon very well. We're still learning about cognitive deconditioning. But what we know from clinical practice is that people who have perhaps some underlying mild cognitive impairment or have some underlying dementia, if they move into an unfamiliar surrounding where they don't recognise where they are, where they don't have familiar faces, and where they perhaps don't get as much interaction as they would usually do, we do see a deterioration in cognition in those circumstances.
Can I just start as a final thought, Professor? I mean, there'll be people watching this who have loved ones, friends, loved ones, who are elderly or have issues around mobility or you know, their ability to do things. Can you change things? Because sometimes I think even families get in the mindset is that, oh, you know, granny's on a downward curve, you know, or there's that sense. So there can be tangible change with some quite basic things. Doesn't change the course of time, clearly, but it can make a difference.
Well, there is very good evidence, going back to that old mantra, if you don't use it, you lose it. So there's very good evidence that even in later life, if you exercise regularly, if you gradually increase the amount of exercise you're doing over time, and remember that magic figure, 30 minutes a day, enough to feel warm inside or raise your heart rate, then you can maintain your function over time and even improve your function over time. The other thing that people can focus on is making sure that older relatives have healthy, balanced diets, particularly that they have enough protein in their diet, and that might mean moving away from the traditional thing of one big meal at dinner and small snacks throughout the day to actually a much more evenly spread nutritional intake over the course of the day, so that they can maintain enough protein intake to maintain their muscle mass. There's plenty that can be done, and one of the things that families can be doing even before their relatives come into hospital is make sure they have enough functional capacity there in reserve, so that we, when they get into hospital, can maintain that as much as we possibly can.